Welcome to The Inner Peace. On this program, we will be talking with leaders in the field of mindfulness and education. My name is Todd Scholl, and I taught for over 15 years in the Myrtle Beach area. Currently serve as the Coordinator of Communications and Technology at the Center for Educator Recruitment, Retention, and Advancement. I'm the father of three and am very interested in promoting mindfulness to help teachers and students manage stress, develop compassion, and promote well-being. On this episode, I have the privilege of speaking with Dr. Amy Saltzman. Amy is a holistic physician, mindfulness coach, scientist, wife, mother, devoted student of transformation, longtime athlete, and occasional poet. Her passion is supporting people of all ages in enhancing their well-being and discovering the still, quiet place within. She is a pioneer in the fields of holistic medicine and mindfulness for youth. She has offered mindfulness to young people from pre-K to college undergrads in socioeconomically diverse schools and communities, and has conducted 2 research studies evaluating the benefits of teaching mindfulness to child-parent pairs and to children in low-income elementary schools. These research projects were conducted in collaboration with the Department of Psychology at Stanford University. To support others in discovering the joy and peace of the still, quiet place, she has written a book. It's called A Still, Quiet Place, a mindfulness program for teaching children and adolescents to ease stress and difficult emotions. She's also created 2 CDs, Still Quiet Place, Mindfulness for Young Children, and Still Quiet Place, Mindfulness for Teens. I hope that you will enjoy this discussion with Dr. Amy Saltzman. So the first thing is I want you to tell us about your background and how you initially became connected to the field of mindfulness.
So I became involved in mindfulness through medical school, and in medical school, through a series of events, I ended up attending a meeting at the American Holistic Medical Association. And then after that meeting, I ended up on the board of the American Holistic Medical Association as the student resident trustee. And that was the year that the Bill Moyer's Healing and the Mind series came out, and it featured the work of Jon Kabat-Zinn at the Stress Reduction Clinic. And as soon as I saw that, I knew I wanted to go and learn from him and the other people at the center. And I really, at that point, when I saw the series, hadn't had any mindfulness practice of my own, but I had been working for a while with my now 25 years later mentor, and she had been enhancing my mindfulness, although it wasn't called that, along with a whole bunch of other skills, which we won't talk about here. And so I went. As soon as I saw the Bill Moyer's Healing and the Mind series, I read Full Catastrophe Living, and I started a daily practice. And then I went to the Stress Reduction Clinic and did like 6 class 1s and 6 class 2s and 6 class 3s and 6 class 4s and I think 6 class 5s before I had to return to my residency. And then there was someone locally who was teaching a course, and I finished the course with him. I went through a whole 8-week series course with him, and then I began teaching 2 patients in the hospital and actually did a research project on patients with chronic pain and chronic illness through my residency hospital. And then I ended up, when I became a parent, as we were talking about, I ended up teaching to parents about the stress of parenting. And then when my son was about 3 and my daughter was 6 months old, and she was mobile really early, so she was often crawling and getting into his stuff and pulling my attention, he actually asked if he could meditate with me. And that's when I started teaching to kids, and we made up a whole bunch of practices, sitting on the couch or lying in bed at night together. And some of those practices, went out into the world, and others of them stayed in our house. But at the same time, I was reading about the epidemics of stress, depression, anxiety, cutting, eating disorders, ADHD, drug use, careless sex, and all of those I felt could be addressed with mindfulness. And, I started to think, why do our kids need to learn this? Why are we waiting till people are 40? Why can't we learn it when we're 10?
And I think that's a really good question. And since I started really in earnest researching what's actually being, like, because I had my own mindfulness practice. Was initially, I didn't even know the word mindfulness. I just called it was a meditation practice. And once I started exploring that and seeing how it worked for me, I start seeing that there were schools that were doing this. And over the past couple of years, it seems like mindfulness in education specifically has started to grow and expand, and you've seen even Time has had a recent cover, talking about the mindful revolution. In the time that you've been involved with mindfulness in education, what has been your perception about its growth, and then what do you predict or what do you foresee over the next 5 to 10 years in terms of its growth? Do you see it growing, or what has been your perception of its growth?
So, definitely from when I started, where there were really only a handful of us offering mindfulness to youth in secular settings, in secular formats, it's grown exponentially. And I think there's both promise and peril in that. So, to me, I really want as many kids to have these skills growing up as possible, because the data and just my personal experience shows that, it enhances the capacity for academic learning. It enhances social emotional abilities. It enhances, wise decision making. So it's a really, really beneficial skill. It enhances kind of peace of mind and sense of joy. And at the same time, I think the growth has some potential problems, because as it gets more popular, school districts will say, oh, we want to do this, but they don't quite know what it is. And because they're stressed and strapped for cash, they'll often look for the least expensive, shortest, kind of bare minimum intervention. And some of those interventions get a little bit formulaic and kind of lose the essence of mindfulness. And so then you can have a school or a district that thinks it's doing mindfulness, but it's kind of been diluted or distorted into something that's not mindfulness in its fullness and its richness and its spaciousness.
Do you think that that diluted form is a result of just not really understanding what it is, or do you think it is maybe a fear of, maybe if we go into this a little bit too strongly, people will perceive it as this violation of separation of church and state, or like that we're trying to infuse some sense of spirituality, or what do you think it is that causes the impetus for that dilution?
Yeah, I think the dilution comes on two sides. So the districts and the schools, I really understand, they want an effective intervention or program, and they are always concerned about time and money, and that's totally understandable. And so it makes sense that they want the shortest, cheapest intervention. However, so I think there's a kind of a consumer side where you look at the schools and the districts as the consumers, but I also think there's a provider side. And I think my concern actually has to do more with the provider side, which is there are people now who are offering mindfulness who don't have a practice, and so they're just not clear about what they're offering.
Right.
And I think that's the primary confusion or concern for me is, like I'll just give you an example of my own. So I have a book that's just out, and my publisher has an affiliation with a workshop promoter. And the workshop promoter wanted me to do day-long workshops for people. And I was totally willing to do a day-long workshop for people. However, the workshop promoter wanted me to give them lots of take-home tools and things that they could kind of use the next day. And I said, I don't think that I can teach someone, even a trained therapist, because this was really more geared at therapists, to offer mindfulness to children in 6 hours. Like, that doesn't feel like it has integrity to me. I can introduce them, I can give them resources, I can give them some basic practices, but to say, you can come sit with me in some Westin hotel somewhere for 6 hours and then go back and use this, skillfully and effectively and wisely with your patients seemed like an oversell. But there is that push in the marketplace, I guess, is what I'm trying to say. Yeah,
almost like a McDonald's version of bringing mindfulness to people. It's a meal, but it's is it a really quality meal? Not
right.
No and offense to McDonald's fans, but yeah. And
I think the thing is also that, like, as a teacher or as a school principal or as a PTO, you wouldn't hire a math teacher who had 6 training in teaching algebra, or who had 6 hours of training in teaching history. So it's a little bit, there's just a disconnect there. Sometimes, and I definitely don't want to imply that there's always a disconnect. But that's the caution.
Right. So do you see, like, I know I get this a little bit. I get when I introduce this and I talk with people about it. At least here in South Carolina, I do get some of the wait a second, this sounds like it's some kind of Buddhism, or what are we doing here? How are we going to bring this type of practice, which seems like some type of spiritual meditation? How do we bring this into a secular setting without setting off alarm bells and having parents call in and complain and that kind of thing? So maybe you can talk about what is a wise approach in introducing this to avoid that kind of issue.
Right. Well, first of all, let me give you, because we haven't talked about it yet, the definition of mindfulness that I use with kids when I teach. So for me, when I teach to kids, I say mindfulness is paying attention here and now. So our attention's not in the past and it's not in the future. It's right here. With kindness and curiosity, because we all know that there's lots of ways to pay attention. And when we pay attention to ourselves, we're often extremely critical. So paying attention here and now with kindness and curiosity so that we can choose our behavior. And choosing our behavior has to do with, how do I behave when I'm faced with a difficult math problem? Or how do I behave when someone taunts me on the playground or kind of jostles me in the hall? And so that definition is a skill that almost every parent and every teacher would want their child to develop. And I don't think there's any argument about it. And that skill allows for enhanced learning in the classroom and also enhanced relationship skills, so that a lot of the distractions that happen in the classroom that prevent learning are minimized. And then to go to the second part of my answer, what I say is mindfulness and compassion are innate human qualities. And one does not need to be Buddhist to practice them any more than one needs to be Italian to enjoy pizza. They're things that we come with, and anyone can do them. And usually when I'm speaking to a group, I lead them through a practice so that they all learn that they can do it exactly as they are with whatever beliefs they have, and that it's possible. And we're not asking them to give up anything or take on something that they don't want to take on. They can practice just as they are.
I think I like that analogy of, you don't have to be Italian to eat pizza. I think that's or enjoy pizza. I think that's a great way to put it. If you're like me, you're in an area where there isn't a lot of this going on, but you would like to introduce it. And let's say you're an educator, you're here in South Carolina, you'd like to introduce mindfulness to your school or your district. What advice would you give to an educator who is wanting to do that? What would be the steps that they should take to do it appropriately and with integrity? Okay,
so the first three on the list, the top three on the list would be practice, practice, practice. So developing your own personal practice is the most important piece of bringing this to your students. And it's really important that you invest the time in that. Then in terms of resources and training, there are online courses now for adult mindfulness that people can do. If they were in your area, I'd send them to you. And then there's an increasing number of really great resources then for once you have a practice, how to begin sharing that practice with students. So my book, if you go on my website, I have a whole list of other people's books. I have a couple CDs. The books are coming out, I would say, almost weekly. I mean, I think I'm reviewing and writing endorsements for probably a couple books a month at this point. So there are a lot of great resources. I have an online training. There are other online trainings available. And two other primary resources that I would suggest are the Association for Mindfulness in Education, and that website is mindfuleducation.org, and then the Mindfulness in Education Network, and that's mindfuled.org. And both of those are places where people announce conferences and trainings. People ask questions like, this came up with my juniors in English today, and I'm wondering how people would approach it. So they're really great resources. The Association for Mindfulness in Education, I'm the director of that, and we just redid our website. I'm crossing my fingers that it's actually up, but it now has a new and improved calendar. People can submit events, they can find events, and very soon a wonderful volunteer has agreed to go back through another great resource, which is at mindfulexperience.org. But there's a man named David Black who every month culls all the literature on mindfulness, like published across the world. And that list has grown so big that I can't even read the whole list anymore. And one of our volunteers has agreed to go through that list and pull the articles related to children, teachers, parents, and those will be posted on the AME website so that because now, you've got mindfulness in business and mindfulness for, a whole variety of medical conditions, and mindfulness in the military. And there's so much research that it can be a little daunting. So we're going to cull it for that research related to children and, kind of ancillary things, teachers, parents, etc.
I want to ask you specifically about teachers. My approach to this has been that if teachers aren't on board, it's going to be very difficult to get this tool to students and administrators, really. And one of the things that I talk about in the presentation I give is there's a MetLife study that was done, I think, in 2012 that showed that about 4 in every 5 teachers and administrators deal with great levels of stress at a minimum of once to twice per week. And it was like, I think, 51% almost every day or every day. And so I know that mindfulness is not just a stress relief, but talk about how mindfulness could be helpful to teachers and to administrators, not just as a stress reliever, but as maybe something that helps them develop a greater sense of compassion for the students in their building, maybe helps them with creativity, helps them with their physical and mental health. Talk about why this is a valuable tool specifically for those in the field of education.
Well, I think that teachers, I put teachers definitely in the category of caregivers. And so I'm going to broaden the conversation a little bit just because there's more data when we do it that way. And teachers do have high levels of stress, depression, anxiety, burnout, what we call compassion fatigue. And, a lot of them, the data for the number of teachers who leave the profession after 5 years is really disheartening. Right. And they went in, loving kids and wanting to make a difference, and they're, exhausted and burnt out. And so I think the broader data on caregivers, and there is some really specific data for teachers out of, by Rob Roser out of the University of Portland, I think, showing that a mindfulness intervention does decrease stress. And then if you look, more broadly with caregivers, and I can get you that data because I'm not coming up with all of it right now, but in general, what we know about mindfulness for caregivers, including teachers, is it decreases stress, anxiety, depression, burnout, and compassion fatigue. And it enhances not only empathy, but efficacy. So the teachers actually feel more effective. And I think what that, all those are lovely words, and there are percentages to go with those words. But I think what matters to teachers is those moments during the day where they might be reactive. So a kid does something, or there's an event in the classroom, or there's the email or the call from the parent or the principal, those moments where we kind of go, and it's in those moments that mindfulness is going to provide some ease and some breathing room and the ability to step back and to choose your response. So this goes back to what I said in my definition. It's not just for kids. As adults, we want to be able to pay attention here and now. Okay, what's going on? That kid said something. It triggered something in me. I'm feeling reactive. I'm feeling like I'm losing control of the room. I'm a little bit panicked. Okay, I see that. Now I have a choice. And, often in those panic moments, we clamp down. And it's like we react and then the kids react again, and it just kind of goes in a reactive cycle. But, sometimes in those moments, if you can just see what's happening, you can say something funny or do something that you wouldn't normally do, and it can just shift the energy in the room without that kind of
right.
contraction around it. And I think there's not a teacher on the planet who doesn't know those moments, you know, or the discussion with a parent, you know, an angry parent or a upset parent or a, you know, it's like if you can stay within yourself and breathe and have some spaciousness and not take what the parent's saying personally and, you know, pause and say, I've really heard you and I want to take a moment to consider what I want to say next instead of just blurting that first thing out of your mouth. Those things make a huge difference, not only in your day-to-day in and out of classroom life, but in your professional longevity.
And you know, one of the things that helped me, not only was the mindfulness practice helped me with that, but what also helped me is when I researched mindfulness and the science behind it, as I've gotten more into the neuroscience and the psychology and understanding how, you know, over time we can develop these habits, which is basically, you know, as neurons, you know, fire together, they wire together. So you start to develop these habits that, you know, when your student does get out of line, you start to develop a habit of overreacting. And for me, it was, you know, I started to develop these habits, but I didn't even understand the mechanisms behind what was going on. I didn't understand really how my brain was functioning and how it all fit together. And once I started to through mindfulness practice, and then through reading the research and understanding how my brain works, and when you start to see the process of, okay, it's not just something that's out of my control. There's actually a process that I'm going through, and I can deconstruct that process when I understand it, and then I can learn how to short circuit it before I have that negative reaction. That was the huge, for me, an aha moment when I developed that ability to see the whole process so that I could deconstruct it and short circuit it before it got into being like overwhelmed and totally stressed out. And so maybe you could talk about that
right.
a little bit.
Well, borrowing from my friend Margaret Cullen, who borrows from the work of Paul Ekman, a lot of this has to do with kind of emotional reactivity. And most of us have an emotion curve.
Right.
And actually last week I was teaching to a group of tweens, and you know, I almost always draw the initial emotional curve as looks pretty much like a normal bell curve. Right. And we drew, everybody drew their own version, you know, and some were super spiky and some were like, they'd get up to the top of the curve in what's called the refractory period, where you're basically in your reptilian brain. Right. And you can't think clearly, you can't hear well, you can't be creative, you can't take someone else's perspective, you can't problem solve, like you're just in fight or flight.
Right.
And, you know, one guy drew this really spiky one guy drew this, like, they're up at the top, he's just like, it was a whole bunch of scribbles. And, you know, the thing is, it doesn't mean we're not going to have that emotional response. It just right. means that we can be aware that we're having the emotional response. And my son has a saying that he honed during a very challenging carpool, which is shut up and sit there. Like sometimes when you know you're in the refractory period and you're in fight or flight, the best thing you can do is just like hold your tongue. And the curve will eventually come down, and then your whole human brain and heart will come back online, and then you can choose to respond. And, you know, unless someone's in danger of being harmed in your classroom, you can always pause and let it slide down the backside of the curve. And,
I like that idea of being offline. Like you've lost that cell phone connection. So you have to wait. It'll come back. You just keep driving, and eventually you'll hit another tower. You know, I like that. I like that idea of. I think of a wave too. You know, either the wave comes and it crashes, and then settles out. And because I think we all feel that. We all have those feelings. It's a matter of what we do with them.
Well, and we talk about, like you can have more than one wave in your body at a time. And if you're in a classroom, if you're lucky, in a classroom, you have 26 waves. If you're not so lucky, in a classroom, you have 35 waves.
Right.
But, you know, in physics, there's what's called constructive interference and destructive interference. So if you've got lots of waves peaking at the same time, then you have huge waves, like a tsunami. But if some of those waves can be flat or actually be in a trough, then it's called destructive interference, and it's smoother. They cancel each other out. And so, you know, if you think of a classroom with 26 waves, you know, if you can get even 6 of those waves, and especially the teacher wave, if you can get the teacher wave to be a little smoother, that changes the environment of the classroom.
I want to make sure before we wrap up the interview that you have an opportunity to talk about the book that you recently released. It's called A Still Quiet Place, a mindfulness program for teaching children and adolescents to ease stress and emotions. Tell me, what can readers expect from your book?
So the book really, in some sense, answers a lot of the questions that we've been talking about today. So it gives some context for why would you teach mindfulness to students in the first place. And it talks about how to develop your own practice. And then the core of the book is presenting the 8-week program that I use with children, including adaptations for very young children and high school students. I've actually used this curriculum from pre-kindergarten all the way through undergrad. So it talks about, you know, how do you adapt the curriculum and simplify it for younger children and enhance it for older children. And then at the end are some cautions and suggestions for getting started. And the last chapter covers some of the research on mindfulness with youth, on executive function, which is how we direct our learning, how we control our impulsivity, how we handle difficult emotions. So that's what the book is. Well,
I just want to say thank you for agreeing to be interviewed. I know that you're busy and have a lot going on, and I'm really incredibly honored that you took the time out of your day to speak with me and be on the podcast. And I do have a couple of personal questions that I want to ask you, but I will go ahead and wrap up the formal part of the interview just by saying thanks.
Yeah, it was a lot of fun.